Welcome to Airway Answers, expanding your breadth of knowledge. My name is Nicole Goldfarb, and I'm a speech-language pathologist and certified orofacial myologist. And I'm here to help you find your airway answers. We're in this together. Let's do this. I'm here today with Ron Ead. And Ron Ead is a really exciting guest for me because I'm titling this podcast an airway patient turned airway advocate experience. So this will be really interesting to hear from Ron and his experiences and how he's you've started your own social media blast and information all about airway spreading across the world. So we're going to talk all about that. First, I'll start out with your bio, Ron. Ron actually is the host and the founder of JawHacks. So if you have not heard of JawHacks yet, I urge you to check out JawHacks, and he'll talk a little bit more about what it is. You interviewed me a year ago, almost to the day, because I was getting a Facebook memory, and I was like, that's so weird because I'm talking to you now, interviewing you, and it was about a year ago that you and I connected for JawHacks. And JawHacks is an awesome platform to learn all about airway from your perspective, interviewing all different professionals in the airway field and talking about mewing and things like that. So Ron from JawHacks is a journalist and patient advocate who has spent the past 10 years studying mewing, expanders, and jaw surgery. He has documented his discoveries in hundreds of YouTube videos and blog posts. He has served as a patient advocate for countless clients navigating their own jaw expansion journeys, familiarizing them generally with available treatments, and connecting them with some of the best dentists and doctors in the world through his coaching service. And we want to clarify, Ron is not a doctor or dentist. You kind of consider yourself a patient coach and advocate. Is that correct?
Yeah, that's correct.
Well,
Yep. I just make people aware of treatments that are generally available. I don't diagnose. I obviously don't treat. I don't ever, actually ever meet patients in person or touch them or treat them in any way. I just let them know broadly what's available in the space, let them know what I think is dangerous, what I think is probably safe, and then I connect them to professionals who can pick it up, make a diagnosis, and then, engage in treatment if that's what's called for.
Yeah. And, having that personal experience, and we'll talk about your journey, but talking person to person is such an important role here because I feel like a lot of our patients see different specialists, different professionals, and get different opinions because there's so many different types of treatment to address airway issues. It can be really overwhelming and confusing to patients, and patients might get different opinions. So to kind of have a coach or someone who's had personal experience with different types of treatments can be really helpful, I think, for patients, like a bridge, someone to connect with. So I think that's a really important role. And let's talk about you first, Ron. So
Sure.
who are you? Where are you from? Who are you? Tell us about your background a little bit.
Yeah, sure. So definitely, like you said, definitely not a doctor, dentist, or any kind of, licensed healthcare provider of any kind. I entered the space as a patient who started documenting his own experience with an expander back in 2017, I guess, is when I started putting blog posts of how this expander was causing changes in my mouth. And I was really doing it. I don't know what I was doing it for, to be honest, because I thought it was cool. And I was sort of just wanted to learn how to use a camera. But at some point, someone shared my post on Facebook and it sort of went viral. And then all of a sudden, my website traffic 10x'd in one day. And I was like, whoa, people are actually interested in this dental stuff. But I guess that's me jumping ahead a little bit. So I'm from a small town in Massachusetts. I went to Catholic schools my whole life. Went to Bates College where I was a philosophy major, like Dr. Gunson. As a philosophy major, I learned to read and write extensively. I wrote hundreds of thousands of words as my major. I had to write a thesis before I could graduate, so I had to choose a research topic, get really deep into it, come to a unique conclusion about that subject. My particular thesis was about Buddhist meditation. I think the thesis was called The Best Way to Become Enlightened or something like that, where I compared and contrasted different meditation techniques in terms of their efficacy for actually achieving nirvana. And I published that paper to my thesis advisor in order to graduate. And so philosophy obviously isn't directly connected to airway stuff, but I think the skill of reading, writing, and thinking critically, and then being able to generate a unique idea and then communicate that effectively to other people in a rigid, tight way that's logical and rational, that skill has definitely influenced my ability to put together JawHacks and to sort of think critically about different treatments in the airway space, just use common sense and reason to try to work out what seems right and what doesn't.
Mhm.
Later, though, in 2017, I began a post-bac pre-med program where I actually was going to go to dental school because I got super interested. After starting JawHacks, I got really interested in um, maybe doing it professionally. I completed a 2-year post-bac pre-med program at Tufts in Medford, Mass, did all the basic science courses, but then and was accepted to dental school, but then didn't actually go for a variety of reasons. The biggest one being the cost. It was just so absurdly expensive. It's like $100,000 a year. So I opted not to go to dental school. Instead, I essentially took over my dad's small tax prep business because he was diagnosed with cancer in the same year that I was sort of transitioning out of the post-bac pre-med program. So I continued JawHacks on the side, took over my dad's tax business as like a source of income. And JawHacks has just continued to grow slowly and steadily on the side. This space, as you know, is becoming mainstream. People are realizing that their airway matters and that a lot of these mysterious health problems that they, they try everything. They perfect their diet, they perfect their exercise and their, sleep hygiene, timing, and getting rid of bad light sources in the evening and cleaning up their mental health. And they do everything perfect. And there's still this mysterious brain fog or bad sleep or whatever. And the buck sort of stops here for a lot of people. And they're discovering that. And that's where people like me and you come in.
Yeah, it's so interesting because there's so many components to these airway issues, which really is an overall like health phenomenon, right? Like a lot of people have chronic diseases and illnesses and autoimmune issues, and it's like it goes back to airway. And so many people don't know that. But I feel like the social media advances and things like you're doing with jaw hacks and spreading the message, social media wise, is really causing an awakening, right? Especially for younger populations, I think. So JawHacks started after you had some airway treatments that you just documented, and then you decided I'm going to start. Do you call it a podcast, or what do you call what is JawHacks?
I mean, it's a channel, a multi-platform channel, I guess. Channel would be the sort of universal word because I do make videos and I do have content that's not podcast form, right?
Mhm.
So just a channel. But
Okay.
I do, the primary source of content is the podcast where I bring actual professionals on and pick their brains. The
Yeah.
rest of the content is sort of just fun content for me and stream of consciousness, thinking out loud about the stuff that I talk to the doctors about.
And you have a lot of followers too on that channel. How many followers do you have on JawHacks? Do you know?
On YouTube, it's a hair over 50,000 now. On TikTok, it's I don't know 20,000, and then I don't know 5 or 10,000 combined elsewhere across Instagram and Facebook, etc.
And
Yeah,
you've
so
reached the
between
general
50 and
population.
100,000.
Yeah, 50 to 100,000. You've reached the general population. Those interested are really, it's around the world, your reach, because when you and I did the interview a year ago, immediately, like within a day, there were 1,000 views. I remember I was like, wow, people are really interested. So we talked about the role of myofunctional therapy in rehabilitating airway issues. And we had like, it was like a 2 hour, it was really good, that podcast. And I think now it's up to like over 9,000 people have viewed that, and people come to me asking me questions. So you and I, we have to do a part two on that because that people were interested.
Anytime.
It was,
I'd love to. That was a good one. That was one that I personally enjoyed a lot and that I learned a lot from. And anytime that I'm learning a lot, I know that the audience is going to like it too because they're going to learn a lot. So yeah, that was a fun one for me. And people are frequently mentioning our first podcast when they speak to me. And so yeah, we should definitely do a part two.
Yeah, it was really fun, really interested, and really interesting. And then hearing about your journey. So you have an ebook, right? You've written an ebook.
Yeah, it's an ebook that I'm publishing one chapter at a time on a subscription model basis on an app called Substack.
And what's the
So
title of
it's
the ebook?
the ebook is called Fix Your Face: The Ultimate Guide to Mewing, Expanders, and Jaw Surgery.
Okay.
So it's a survey of uh, essentially everything in this space. So the driving question behind it is, how do I expand my jaws? So the book assumes that you've already reached the conclusion that your jaws need augmentation.
Mhm.
And so then the question becomes, okay, what do I do about it? Do I just do myofunctional therapy and mewing? Can I use my tongue to expand my jaws? The answer to that question is obviously no. But it's more subtle than that, because even though you can't expand your jaws with mewing and myofunctional therapy, they're still worth doing. So I get into the subtlety of what is the role of mewing and myofunctional therapy for adults. Then uh, the other major part is, okay, how do we mew? What does that really mean? And that sort of gets into the comparing and contrasting mewing and myofunctional therapy. Then the next big part is how not to expand. And
Mhm.
that is a survey of everything that's wrong with tooth-borne expanders and the dangers around, using tooth-borne expansion as the primary treatment modality for making your jaws bigger. And the thesis there is basically that tooth-borne expansion should be the sauce, not the meat. You can do a little bit of it, but you probably shouldn't do too much. Otherwise, you're going to damage your teeth. And then the last part of the book, which is the part that I'm into now, is okay, the practical guide to the safe ways of expanding your jaws. And that essentially revolves around MARPE and jaw surgery with the sort of auxiliary treatments mixed in, like SFOT, and protraction devices, reverse pull headgears, splints, mandibular expansion via the MSDO or the DAME method that Dr. Yousefian does. So that's really the heart of the book that people are interested in, and that's the part that I'm into now. That I'm publishing one post a week, probably for the next 3 or 4 months, and that'll be the conclusion of the book.
Okay. Okay, really interesting. So for you personally on your journey, I was reading so far some parts of your ebook that you already have published, and you talk about you want to expand your jaws due to chronic headaches. So you said the heart of my journey from 2014 to present was answering the question of how to expand my jaws safely and effectively. So you talk about nerd neck posture, which not scientific, we'll call that forward head posture, but I assume nerd neck posture is a forward head posture position, right? So you
Correct.
talk about that position, and I'm going to quote like a little bit of what I read. Is that okay if I?
Sure.
Okay. So
Yeah.
you were, while meditating, this is what you said. It occurred to me as I tried elongating my neck, I felt a tightness in my throat, almost like I was choking. My brain instinctively pulled me out of the elongated neck posture back into nerd neck in order to reopen my throat so I could breathe more comfortably. Now, I know exactly that feeling. And I think a lot of our patients know that feeling. And other people who have such airway problems don't know that feeling because they're chronically in that forward head posture and don't even attempt to sit up straight because that their body, it would be counterintuitive to breathing in their airway. So when you were doing your meditation and trying to sit up straight, you felt like you couldn't breathe well, right? Can you talk about that a little bit?
Yeah, sure. So I was waking up with these headaches almost every day, and they were at the back of my neck. That's where they would start, and then they would radiate up and over into my eyebrows and into my temples. But I knew that the neck was like the nucleus of this, the back of my neck specifically. So I was living at a Buddhist monastery in your neck of the woods, actually, in Valley Center, California, in San Diego County. I was meditating, 4 to 8 hours a day, depending on how much work chores we had that day. And so I had all this time to just be with my body. And as I don't know if you've made this observation, but I certainly have with my clientele, people that have more opportunity to be present with their body and that are more introverted or interoceptive, I think is the word that's used. People who have a better sense of their inner experience of their own body are more likely to discover their jaws as a problem for them. So I was in this perfect place for like just feeling my body essentially. And I was trying to understand, okay, what, what is happening with my neck? Why is my neck constantly sore? Why am I having this one big multi-month long headache? And I realized it's this thing is this, it's impossible for me to like hold my neck in this unkinked way. Like no matter how hard I try, if I try to go like this, which would provide relief, like if I would just like stretch my neck a little bit, it felt like a tremendous amount of relief. But as soon as I was just not paying attention to that, I would immediately go back to this.
Yeah. You're opening
So,
up your airway, right? You're like self CPR, right?
right, right. So then I was like, okay, why does my body, like an elastic band, just keep snapping back into this neck posture that no matter how hard I try, I can't get out of it? And then it occurred to me, I started doing this weird thing. I remember being at the monastery, and for like 3 months, I was walking around with my mandible jutted out like this. And I was like, okay, I can keep the neck posture when I stick my mandible forward like this. But like, I'm going to bite my tongue off if I keep doing this. Like, because I was doing it when I was driving and I was doing it when I was working. And I was like, if I'm not careful, because I was also sticking my tongue out because it was just providing so much relief to my neck to just like stick my tongue out. I was like, if I'm going to bite my tongue off eventually if I just live like this. I can't. So then naturally I was like, well, how do I maybe make my mouth bigger? And then
Mhm.
the idea was born. I started Googling like jaw expansion, palatal expansion. This was 2014. There was some stuff online about it back then, some stuff about mewing. Dr. Hang was popular back then. He had his, I think it was called face focused orthodontics.
Mhm.
In 2014, I took like 2 buses, 3 trains, and a taxi from the monastery to his office in 2014. I was like this smelly monastery boy.
He's like, who is this guy?
Oh, he was so weirded out, but he was so kind to me.
Yeah.
Him and his wife
Yeah.
met me, and they were like, I was like, I want to open up my extraction spaces because I
Yeah.
had when I was in the 7th grade, I had 8 teeth pulled. I had
Okay.
4 premolars and 4 wisdom teeth removed. And so me being like an all natural health nut, I was like, all of a sudden everything was clicking. I was like, oh,
Yeah.
my headache started when I was a freshman in high school. That's right when I got out of braces after, my extractions. I remember the first time that I ever felt the headache pain was freshman football when I hit the star running back. I tackled him. Actually, he pretty much ran me over, but I remember feeling the zing in my neck right at that time. Maybe this is all connected to those extractions and my orthodontics as a kid. And if I just put those teeth back in, I'll be better. So I went to see Dr. Hang and he was like, sure, I can do this for you, but it's going to be $14,000. I was like, I got like $20. And
Like I
so,
took 3 buses, 2 trains, like I did not drive here. Wait, but this is interesting because you were at this Buddhist monastery, like searching for yourself, peace, whatever, and you had like airway enlightenment, right? Like, isn't
yeah.
that interesting? You really did get a major enlightenment from connecting within yourself, realizing, wow, like it's all connected in your breathing. It's just really interesting. Yeah, okay, keep going. So
So,
doctor
so
that it was expensive.
just to pick up on that point though about
Hmm?
airway enlightenment. So also at the time I was introduced to one of the Buddhist texts, and there's a line in the Buddhist text where he's teaching the monks how to meditate. And he says, monks, when you're meditating, you need to press the tongue on the roof of the mouth.
Yeah.
And I was like, I asked the abbot of the monastery, I was like, is this real? Like, do we really need to be pressing our tongues on the roof of the mouth? And then unfortunately at the time he said that it was figurative and that it just meant that you should push earnestly and push hard with your meditation and like strive really hard, but that it was not literal to press the tongue up on the roof of the mouth. But I disagreed at the time with that, and I continue to disagree. I think the Buddha meant it literally because the type of meditation that I was doing, to not go too deep into this, but it's a very specific kind of meditation called concentration meditation or jhana. And essentially what you do in that meditation is you manipulate your subtle energies in your body and you sort of gather them together and condense them into a unified point and then sort of go into it as a source of concentration. And what I was finding was that when I was actually pressing my tongue on the roof of the mouth, these amazing energies were arising in my body that would not arise if I didn't press the tongue on the roof of my mouth. So I was like in lotus posture. And then having done that without pressing the tongue on the roof of my mouth, it felt one way. And then when I pressed the tongue on the roof of my mouth, it like unlocked this whole energy in my head. And I was like, this is real. And this is definitely the way forward. And the Buddha actually says it. And so that was also connected with my insight about this weird thing happening in my mouth, because I realized it was not easy for me to press my tongue on the roof of my mouth, and that when I did it, my bite was skewed. And then also I could only do it comfortably if I really jutted my mandible. And I just knew that the box was too small. And yeah, that was all part of the airway awakening, as you called it.
And there are connections to the vagus nerve, and that tongue is up in the correct posture. And there's neurological connection. So it is a real thing. And even in Asian medicine or yoga, it's a thing to have your tongue up on the roof of the mouth. That's, a practice in yoga. And it's just interesting because it's true. It's a real thing. There are calming, regulating systems engaged in the body when our tongue is correctly positioned in the mouth. So
Totally.
you felt that. And then you realized, okay, I can't afford this type of treatment with Dr. Hang. So what was your next step?
So the next step was I did nothing for 2 years. I continued to suffer. The headaches got worse. By 2016, they got so bad that I up and left the monastery. I remember being on the side of the road at the monastery on the edge of the woods one morning, and the headache was so bad I was vomiting yellow bile, and I was on an empty stomach because you don't eat much at the monastery. I was just like, wow, man, this is rock bottom. So I left the monastery, stayed at a hostel in San Diego for like 2 weeks just to try to decompress from the very high pressure environment of the monastery. And then And then in the meantime, the past 2 years, I had been shopping for cheaper alternatives to Dr. Hang. Foolishly, I was cost conscious, which is a huge mistake that patients make. They think $5,000 or $10,000 either way is going to matter
Yeah.
for their finances long term, but you make those small financial compromises, you end up, instead of being with the best, you end up with being with someone who's average, and that's the difference between a good treatment and a not good treatment so often, right?
Yeah, and you might end up spending more money in the long run because trying to save here or cut corners here, now you've kind of messed up in other ways and have to fix other problems. So,
Well,
yeah.
story of my life. I mean, I cheaped out on Dr. Hang, and look at all the crap I've been through since then.
But now you can tell your story to help guide. That's the thing I think, is having personal experiences with oneself, family members. Sometimes that's the deepest insight when you've gone through it and you can explain it. And okay, so then what happened next? You're in San Diego decompressing.
Yes, so I had found this other doctor in Aurora, Colorado, who wrote this book called Straight Talk About Crooked Teeth. His name was Kent Lawson, and in that book, he talked about expanders and using expanders for adults, similar to the kind that Dr. Hang was using, essentially an acrylic expander that had a little bit of transverse expansion and then did a little bit of pushing on the front as well. Um, and on my way home from San Diego, so I bought a car on Craigslist. I'm driving back east, and I stop in Aurora, Colorado, and get this expander with this guy and start using it. And the very long and the short of it is I used it for about a year. It did nothing good for me. It tipped my molars out pretty aggressively. I ended up getting these little wounds on the insides of on the maxillary side around the first and second molars. Uh, the headaches were not better. I was seeing an osteopath in the Boston area. He told me I was crazy for having this clunky piece of plastic in my mouth to get it out, that it was doing nothing good for me. I listened and I removed it. And then I essentially aborted that treatment and then moved on to the next thing until eventually I ended up doing another failed tooth-borne expander.
Okay.
And that was sort of the death sentence for me in terms of like my faith in the potential of tooth-borne expansion.
And were you documenting all this at the time?
Yes, this was all documented
Okay.
if you go deep into the archives of JawHacks.com, you might still find some of this stuff. But yeah, so come 2018, I'm on the tail end of my second tooth-borne expander, and I was like, this is not the way.
Mhm.
But I need to find a way to make my mouth bigger because I just know that this has to happen. I can feel it. The headaches are not better. Um, and I'm also having this responsibility to the public of like, okay, this failed. What's next? Is Ron just going to disappear in shame off the internet, having failed in his attempt to expand his jaws? Or is Ron going to figure something out? So come January 2019, I pulled a second expander, and a consulting client of mine, had visited an office in New York where he was offered this MSE thing. He called it MSE. I was like, oh, what's that? He was like, oh, it's this skeletal expander. It splits the roof of your mouth. And when I had talked to him, I was like, no, dude, that's too invasive. I said, that's
Mhm.
too invasive, because I was still in that sort of newbie mentality of, oh, anything that has to do with breaking bone is too invasive, that so many people fall into that trap and then they end up doing tooth-borne expanders. I mean, I crap on that trap all the time. I always am on my channel. One of the main ideas you'll find is tooth-borne expansion bad, and I
Mhm.
get a lot of flack for that because there's so many people that when they enter into the airway space, they're just fixated on tooth-borne expansion as being this less invasive approach, and they think that skeletal expansion and jaw surgery is just too much. They think it's barbaric or too aggressive, unnatural, whatever you want to call it.
Mhm.
So I lived through the dangers of tooth-borne expansion, so much so that when I first heard about skeletal expansion, I myself poo-pooed it to the guy who eventually put me on to the expander that I would eventually do. Fast forward 6 months, I had an MSC in my mouth. My suture was split. I got this immediate relief to my breathing, a massive amount of tongue space in like 3 months. I gained like probably 6 or 7 millimeters of skeletal, width in my palate. My nasal breathing was amazing. And then I was documenting that, of course. And then people were like, okay, they saw me go through that and they were like, yeah, this could be legit. This could be a viable option for people who want to expand. And then ever since then, I've been trying to dive deeper into, you know, the pros and cons of skeletal expansion, the
Mhm.
dangers of skeletal expansion, because Lord knows there's plenty.
Mhm.
But then also the next frontier, which is the frontier that I'm now interested in, which is orthognathic surgery.
Okay.
Um, and
So
so
it only took you 6 months to go from the tooth-borne mentality to, okay, I need to do something invasive with a bone-borne. It kind of sounds like you did a shift of like 6 months. You're like, here we go, I'm doing this.
Well, it's 6 months, or you could say 6 years, right? I mean,
Right,
whatever way you
totally.
want to think about it.
Yeah.
But yeah, no, I had a paradigm shift. I had an inner shift where I was like, oh, well, I ran out of options. I mean, my teeth couldn't handle any more force at that point, so I had no choice but to look to the bone.
And you hadn't felt relief. So in your ebook, you say, I had learned an important lesson. Adults cannot achieve safe, substantial expansion of their jaws with appliances that press on teeth. This is your personal experience. With tooth-borne expanders, the teeth budge before the bone, and the final result is much dental change, but no expansion of the actual jaw bones. 2 months later, you had a total of 84 turns. So you did 84 turns on your MSC and you got all that maxillary widening. You felt an incredible feeling with so much more tongue space. You felt increased nasal airway, better nasal breathing. Following MSC, I had a dramatic drop in snoring and an immediate subjective experience of feeling better upon waking and with fewer headaches. You were breathing better at night, less clenching your jaws. And within a few months, you said, I noticed a significant drop in pain at the back of my neck, indicating that my neck posture was starting to elongate and decompress with my now larger airway. Now I could nasal breathe effortlessly while running and without neck pain and headaches. So can you talk about like how those feelings occurred when you had the suture split with the MSC and like what happened? What did you feel?
Sure. I was I was always pushing the limit of the structure that I had for years. I was trying to get my tongue to fit well on the roof of my mouth when it was still small. I was optimizing every aspect of my life when my jaws were still small. So when my jaws were finally made bigger, I was basically ready for it. It didn't just that change didn't just get lost in the noise of like all the distraction of my life, as some people report, because some people will do a jaw surgery and they'll be like, "Yeah, I don't really feel a difference," and I'm
Mhm.
just like
You
how?
were, and you were hyper aware too, like of
Yes,
everything. So you're really thinking about it, which probably those of us in the field are the same way. When we do a treatment like this, that's how I was when I did the MSc, and I searched for about 2 years as well to find what kind of treatment will change the bone. I don't want anything temporary. I don't want anything I wear just at night. This was my personal feeling. I wanted something that might change the bone, so it would be like a 24/7 change. So I did the same thing I'm like, by the age of 40, I'm gonna have this figured out. Well, that didn't happen, but it took 2 years of me deciding. And then I did the MSc and I noticed similar changes with breathing, more tongue space. But I was very hyper aware of everything, like every little feeling, which is kind of cool to document when you're so interoceptive, right? Is that the word you used in the
yeah,
beginning? So you're
yeah.
feeling, so you're aware. So you're feeling like your tongue has more space as as the upper jaw is expanding. What else did you feel?
So the one tangible change in my life that occurred is that I was able to establish a running habit, which I had been trying to do for 10 years. In like 2010, I don't know if you were privy to this, but in 2010, there was this whole paleo health revolution that happened online with like the primal blueprint of Mark Sisson and like the book Born to Run, which was about barefoot running.
Yeah.
And I was super into that. And I always wanted to be able to barefoot run because I just thought that there was some key to life that was in barefoot running, that something I was missing. But I could never do it. I would run for a couple days, and then all of a sudden I would wake up on the third or fourth day with this just 3 day headache, and I was just like, oh, never again. And I knew that it would happen because when I would run, it just felt super uncomfortable. It would be like riding a roller coaster. Like I had
Hmm.
this instability in my head, and it was like a bobblehead.
Yeah.
And then running even barefoot running there's somewhat of an impact there. So I just couldn't handle running without the expansion, essentially, is what I'm saying. So it comes September 2019, I stopped turning my MSc in like August or early September. In September 2019, literally, like the thing is still in my mouth, I'm still turning it. I buy a treadmill on Craigslist. And I was like, all right, I'm going to do this. I'm going to start running. No excuses. I'm going to have a treadmill. I'll do it indoors if I have to. Start running on the treadmill, super light, super small, like a half mile a day, and
But are you barefoot at this point?
totally barefoot on the
Okay.
treadmill. Like if you look at my treadmill, you actually see like a yellowing of the center of it because of all the dead skin that's on the
That's so
treadmill.
gross.
I know.
It's like
I
callus removal. Okay.
yeah. So to this day, fast forward 5 years later, to this day, I still run 4 to 5 days a week. This
Okay.
morning I ran 2 miles. So finally the habit took.
Mm.
And because after the MSc, I could run with nasal breathing because I knew that the only way that I would run was by nasal breathing the whole time. Because I even in college I had read this book by this guy named John Deweyard, who talked about the key to entering flow state was to do nasal breathing while exercising and to never even don't exhale through your mouth. Certainly don't inhale, but don't even exhale through your mouth.
Mm.
Because when you nasal breathe, it sort of sets the rhythm of your exercise. It forces you to not go too hard, but not go too slow, and you just sort of find this sweet spot of flow state. And I was super intrigued with that idea. Well, now after the MSc, I'm able to actually do this. I can actually run without having to, bust open the mouth to just be able to, do
Yeah.
it. And so running felt good. And then when I started running every day, then now I'm in the upward spiral, right, of health where I'm getting all the benefits of that. I'm getting all the
Yeah.
happy chemicals. I'm getting the blood flow. I'm getting the increased appetite. So now I'm burning my food better. I'm not getting as much fatigue from eating. I'm able to cheat more in my diet without having catastrophic, breakdown because I was super food sensitive before. Now that I'm exercising, I'm just not as OCD about my eating.
Yeah.
And thus begins the upward spiral.
Yeah.
But yeah, so being able to habituate a running habit was one very tangible outcome of the expander for me because of the ability to nasal breathe at higher levels of exertion.
Yes. And I really like that. I'm a runner also. I did like a 4.5 mile run today, not barefoot. I
Nice.
don't think I can do that, but that's my meditation. That's my like peace and zone when I go running. It just, you're in that flow state, and I nasal breathe only. And I think I used to probably open mouth breathe when I was running, although as an adult I've never been a mouth breather, but when running, that can happen. And I watch people as we cross, I'm always like mouth breathe, like you see everybody has their mouth open. I want to make like a running tank top that says something about like closing your nose and like point across people. But when I made the shift to nasal breathing when running, I remember it's uncomfortable at first. And you said nasal breathing sets the rhythm of your exercise. I'm like, that is so true, because you have to slow down, right? Because you're kind of start getting out of breath, and you have to slow down if you want to maintain the nasal breathing. So you kind of slow down, and then your body gets that rhythm, and you can pick up the pace then. And, depending on how you feel. And I felt like after the MSE, I could run better. So even though I was already nasal breathing when I was running before that, I felt like I could run longer distances. It was less like painful. I was less sore the next day, and I actually didn't dread it. And I kind of am that runner where I'm like, oh, I don't want to go, but you got to do it. Just do it. And it wasn't even dreadful. I'm like, yes, it was exciting. Like it wasn't as exhausting. So just that slight change in nasal airflow can cause a substantial increase in oxygen absorption. And that I always think of that physics law of airflow dynamics, Puso's law, that any slight increase in the radius of a tube causes a decrease in airflow resistance to the fourth power. I think I'm
Wow.
correctly. But we're talking millimeters of expansion of the palate, right? With like an MSE or MARPE, but that slight expansion is increasing nasal floor volume and decreasing airflow resistance. And it's slight, but significant, right? So you're like,
Totally.
oh, a few millimeters, whatever, but no. And you feel that. And I thought I was making this up, but before my suture even split, I didn't know like exactly what's happening when I'm turning. Like I thought it's like nothing happens and all of a sudden it just like hops open or whatever. But I was like, I'm not going to say anything because I'm probably making this up because I'm too interoceptive, like feeling everything and being superstitious. But I'm like, why do I feel like I can breathe better through my nose? I feel like it's like Afrin or something, like a spray. And it was before the suture even split. And what I came to learn is it's already like kind of splitting over time, a little bit until you get a full sutural split. So it probably was slightly opening up. But yeah, I just felt like the nasal breathing was better. And the postural change, I want to talk about that because headaches. So my husband's a physical therapist. I've had this headache issue also, which is way better now, but same thing. So forward head posture causes like a compression of the suboccipital nerve, and it can cause that shooting pain up into your eye. For me, it goes eyeball, tooth. Like I even thought something was wrong with my tooth. I'm like, why is this molar hurting? And then it leads to like a migraine and nausea, like what you described that one horrible day. I get the same thing. And it would last 3 to maybe 4 days. And you feel it coming on. For me, it's like one side of the neck. And I'm like, here I go. I'm screwed like the next few days because I'm going to be like, I won't be able to do anything. And it's like nerve compression from poor posture. But why is the poor posture? Because your body's trying to breathe, right? So did you feel like when you had the expansion, automatically your posture changed, or did you have to work on it? Did you go to physical therapy, or do you have a
So
recollection of that?
for me, it automatically changed, but that's because I was already doing the therapies beforehand. But
Yep.
I suspect that someone who hadn't been doing years of trying to optimize the posture before the expansion, that they would need to put in some work. I don't think it happens automatically for people that are like brand new to the space and have no prior myofunctional therapy or physical therapy or no fitness regimen. But
Yeah.
I was ready for it, and it came naturally.
Yeah, you were doing everything like physical posture wise anyways, and you're like, I can't get there because my body's not holding it. So we work with a lot of PTs in our office, and it's a similar thing. Like you can treat the posture, but if you don't treat the airway, the posture is never going to hold up, right? And like before I started educating the PTs that we work with about this, there there were patients who were like recurrent patients, like with headaches, neck issues, and they just keep coming back. Like it wasn't holding, it wasn't getting better. And now we're like, oh my gosh, those are all airway patients.
Yeah.
Like a lot of the PTs aren't aware of that.
I'm so glad we're talking about neck pain because it's like it's coming full circle for me and my channel because initially my channel was not called JawHacks, it was called Migraine Hacks. And no one cared no one cared about the migraine posting that I was doing because apparently people didn't have migraines as much as I thought they did. Like I apparently I'm the only guy who has this jaw problem and headaches. So I changed it to jaw hacks because all people only cared about the expansion part, not the headache part. But as of this year, especially,
Mhm.
I have so many people coming to me asking me about neck pain, cervical instability, chronic migraine, uh, and how that is related to their jaw structure.
Yeah.
So it's such a huge topic, and it's one that Dr. Alfie is particularly interested in as well. He told me that he has so many patients who come to him primarily complaining about neck pain for
Mhm.
jaw surgery, for MMA
Yeah.
surgery, and they get tremendous relief from that advancement of the jaws for this reason that you're describing, which is that when you open up the airway, you get less of this compensation
Yeah.
of the forward head posture.
Yeah, and it's all related. And when we're postured forward, you think CPR position, right? You're physically opening up the airway, but your body's doing that subconsciously. And it's interesting because both my kids have had airway issues, and you could see the postural problem is there from a very early age if there's a jaw deficiency. And it can be 24/7. And I videotaped and I lecture on this, showing pictures of one of my, actually both my kids, um, how like during the day, like my older son, he's like an old man, right? Like so hunched forward. And then at night, when he was having major airway issues, he was postured with the neck hyperextended, which is a big red flag. When we sleep with our neck hyperextended, our body is struggling to breathe. Well, look at all that compression that you're putting on the back of your neck. It's by default that has to happen, right?
Yeah.
Gonna lead to that cascade. So it is interesting because I think if you're not working on the posture also, and especially as we get older, and it doesn't even have to be that older, as a child, maybe age 8, 9, 10, the muscles have already lost a tone that they need to hold the body upright. So I feel it as an adult, like I need to do physical therapy to strengthen my upper back because I still slouch because the muscles aren't used to like holding it up. So when I try to do like my exercises for PT, I get achy and tired in my upper back because my upper back is like, hey, you haven't been using me. You've been
Yeah.
like slouched for, 45 years or whatever. So I think the combination of like a good PT who understands the relationship between airway and posture is also important for a lot of our patients.
Yeah.
Um, and it's
No, totally. Yeah, totally. You said so many interesting things that I want to respond to. So one thing I want to just put out there, full transparency on my end. I still get headaches, although they're much less frequent and they're much less severe. And so I still have compromised neck posture. I'm still doing weird things in my sleep that cause me often to wake up with this cervicogenic sort of head proto headache that will, so it used to go from a 3 to a 10. Now it goes from a 3 to a 0 with time. So things are much more subdued, but I still have something going on there. And I want a jaw surgery for myself. I can imagine having this 1 centimeter advancement and it just decompressing all of the muscles and things in my face, and that's a missing link for me personally. And so like one thing I do and I get tremendous relief from is I'll just pull my tongue out of my mouth,
Mhm.
and it just feels so good on my neck.
Yeah,
It's weird. It's like by
it's connected,
touching
right? Mm-hmm.
totally, which
Mhm.
people don't realize that, but if your tongue is boxed in, that's gonna flow backward to your neck.
Yeah, and
So
I'm
like,
sure have you seen the pictures of like the fascial system and the deep frontal line? And in anatomy trains where they do dissections, they pull on the tongue and the toes move. Have
come
you heard
on.
that? What?
No,
Yeah,
no,
I'd love to go to those anatomy lectures and do like body dissections to see that. It's crazy. The tongue is connected to the toes. They're
incredible.
through the deep frontal fascial line, and that's the whole the PTs are, who are into this are well aware of that. So it is interesting that whole body connection. You can't treat just one area. And I like how you just said full transparency because the same thing for me. MSE did not cure everything. It put me in a state where I'm like, I'm so much better. Like I feel good, but I still get headaches, not chronically. I have to sleep a certain way. So I elevate the head of my bed. I have like a pillow that helps like with a little bit of hyperextension because you can't, like Dr. Hang says, expand your way. You can't expand your way out of an anterior posterior problem. So this is not just a narrow palate that's the issue, but the jaws have not grown forward enough. And I also fantasize about like if my jaws were like both forward because they want to be that way, but jaw surgery would be the next step. So are you
Yeah.
considering jaw surgery?
Um, in the medium term, not in the short term, in the
You're like
medium
six
term.
months, you're recovering from surgery. No.
I think if I get an opening at some point in my life, I mean, I have a baby daughter now and I have another child on the way,
Oh,
and
congratulations. I didn't know
thank you.
that.
Yes, yes, thank you.
Yeah.
And a mortgage now, unfortunately, and so the pressure is on for me to like produce right now.
Yeah.
Um, so but someday, I mean, right now things are stable enough where like I'm fine. And from a jaw surgery perspective, I don't think it's going to make a huge difference if I do it at 35 or 40.
Right.
Um, so yeah, someday if I get the opportunity, I would love to. And also the main interest of my channel now, as I alluded to earlier, is learning more about jaw surgery and how to do that right. What to look for in a surgeon, who are the best surgeons, how to vet treatment plans that are proposed to you by various surgeons, custom plates versus non-custom plates. Does it really matter? Et cetera, et cetera. All these huge questions. How much advancement? A moderate advancement, 1 centimeter, or a huge advancement, 2 centimeters? Because you could see three surgeons, and one would recommend, 7 millimeters. The other is recommending 14. So what's right? And
Yeah.
how to deal with this tension between aesthetics and airway when it comes to
That's
jaw surgery.
that's so important because there's a lot of jaw surgeons who aren't airway focused, but maybe solely aesthetic or will actually retract the jaws to line them up. So I think we need, just like any orthodontic treatment, we need to be airway minded focus. That should be the focus, right? And you
Yeah.
would probably find this interesting. I interviewed a combination Dr. Bill Hang and Dr. Brian Hockel together. So Dr. Hang, we talked about him. Dr. Hockel is an orthodontist in Northern California, and he's also trained by Dr. Hang in the orthotropics approach, and they're really close colleagues. And Dr. Hockel just had orthognathic surgery. Finally, I guess he's was on the back burner for a while. So he talks about his experience. So I think that would be interesting. Maybe your listeners would be interested in watching that. He talks about, many patients avoid it and it's easier to recover from things when you're younger. And he avoided because he didn't want to take 6 weeks off of work because he had a busy practice of orthodontics and he was the only practitioner. And he's like, I can't take off work. I can't. It's for my patients. So he wasn't really attending to himself and his own needs. So he finally had the surgery. Now he's a year out. So he talks about the recovery, his experience, and he went with Dr. Reza Movahed and Dr. Hang did his orthodontic treatment. Then he also, treated himself. But it was an interesting experience to listen to. So he was trying to convince me, well, or I was trying to be convinced. But yeah, it's exactly that with the MSC or the MARPE, you will probably get a lot of relief and maybe it'll fix everything and maybe you're going to have some residual compensations that your body might just need to do and um it's helpful in most
Yeah.
cases.
Yeah. I saw Dr. Hockel's result and it looks amazing, by the way.
Yep.
And certainly Dr. Movahed is in the pantheon of top surgeons that people are talking about. and I would certainly consider working with him. No doubt, he looked like Dr. Huckle got a pretty big, bold advancement. I mean, it looked pretty significant. Um, and then the thing about that, though, that really caught my attention was I saw Dr. Huckle's post on Facebook, and
Mhm.
then I scrolled down to the comments, and I saw that Mike Mew commented,
Yeah, I saw
and
that. Yeah. Hmm.
he said, Brian, sometimes I feel like I wonder if 60% of the people that I talk to should just do this.
Right. And then
And
John was Mike's dad, John Mew, I think was not happy about that comment. Yeah.
but it's just, to me, that is this space coming full circle where
Yeah.
it either the Muse sort of brought this all to the public awareness. It was a very anti-surgery approach. We all went through a period of being anti-surgery and trying our tooth-borne expansion approach because we thought it was less invasive. But fast forward 10 years later, and now you have Dr. Mew himself, at least baby Mew, not Godfather John Mew, but Mike Mew.
Yeah.
Mike Mew is coming full circle and saying, maybe maybe jaw surgery is a great bang for your buck for a lot of people,
So
where
talk
you can
about
just
like
slam the jaws
lifelong.
forward.
Totally, yeah. Bring the just for and what a like interesting comment that he said that posted on social media. It's not like hidden information. And the ability to like continually learn and know maybe your thoughts at one time maybe weren't right, or you can change your line of thinking is pretty bold and amazing. And it's great that Mike Mew made that comment and was supportive of the jaw surgery approach, because Mike Mew and John Mew and Bill Hank all do the orthotropics approach for younger children too, where they're
Yeah.
they're doing that technique. So that's really interesting. And
Although I did ask Mike about it in a podcast that I did with him a couple of weeks ago. I said, Mike, what did you mean by this? Because I thought he was going to elaborate, and I thought he was going to say, Ron, you know, jaw surgery isn't as bad as we thought it once was, and the benefits are just so amazing. And as long as you choose the right surgeon, like Dr. Moverhead, everything is going to be okay. But he didn't, and he kind of backtracked.
okay,
He
interesting.
he was like, oh no, I didn't mean that 60% of people I talk to should just go and do surgery. I meant that 60% of the people that I talk to would benefit from having their jaws advanced. And I was like, sure, but so then that's almost a tautology. Like, of course they would, but what are you really saying? And then he kind of was on the fence and didn't really want to commit. So I don't know what's going on with that,
What
but
that meant.
I should clarify that he did backtrack.
Yeah, that
But
is important. Hmm.
to me, though, my reading of it is still what it appears to be at face value,
Yeah.
honestly.
And I mean, we're not gonna play around with having a jaw surgery like it's not a big deal, right? That is a really big thing to do. And so I think that bold recommendation needs to be a little bit cushioned, like, okay, this is a big surgery, it's a big procedure. But Dr. Hockle talks about, living a life where you're not breathing well has probably more significant effects than the risk of having a jaw surgery. So
Yeah.
yeah, it's interesting. I mean, if it was an easy, quick thing, I'd be like, done, sign me up. So it's a little
Yeah.
bit, yeah, uh, scary thing for me.
Yeah.
But so can you talk a little bit about mewing? Because that's a big thing that you kind of started your thoughts or your jaw hacks with mewing and supporting that. And what is that? So I think a lot of people maybe don't understand exactly what mewing is, um, how it applies here, how you teach people, or to like, can you just talk about that? Because that is a international phenomenon, I think. I've been traveling for different things and I see adults in the street mewing. My kids are using the word mewing at their school. I'm like, what are you doing? And I see they're like, doing all this, and they have Roblox video games. Okay, my kids play Roblox. I don't know if you saw, I posted about this because there's a game, multiple games that are mewing, and it's like grow your jaws, and you get like little points for growing your jaws. And it's like my son's little character was retrognathic, but now he has to mew his character and you jump down. And I'm like, this is crazy. This is a video game now. So I think it's drawn a lot of attention. So can you kind of talk about what mewing is?
Yeah. So I think that the difficulty of discussing mewing is that there's not a solid definition for it. And as now here comes like the philosophy major in me. Before we can talk about something, we need to define it. And I think that every people who use the word have very differing definitions for it. So I think in Roblox, mewing probably refers to chewing tough things and pressing your tongue really firmly onto the roof of your mouth so that you can look better. But
Mhm.
it probably doesn't involve a more comprehensive understanding of myofunctional therapy and airway. My definition of mewing is, and as I state in my book, I sort of hijack the term and use it the way I want to. My definition of mewing essentially makes it synonymous with myofunctional therapy, which is mewing is all oral, facial, tongue, lip habits that are natural and healthy. The oral, functional, postural habits that nature intended for us to have, that when we have them, our face and our mouth and our airway functions better.
Okay.
So it's a more comprehensive definition of it. And when you think of it like that, I think that more brings it in line with myofunctional therapy, which my understanding is it's the effort to get people to use their face better and in a healthier way and to undo some of the, tangles that they have in their face from a lifetime of bad habits with their tongue and their lips and their swallowing. So I what I propose in my book is that mewing, I use that term just because it's easy to hashtag it and because it's better
Okay.
known than myofunctional therapy. Um, at least with my audience, which is primarily, young people between ages 15 and 25. My elevator pitch for mewing is that it's necessary, but it's not sufficient for people that want to expand their jaws. So what do I mean by that? Mewing is not going to, when I say mewing, pressing your tongue up on the roof of your mouth, or as I clarify in the book, suctioning the tongue onto the roof of the mouth.
Mhm.
My understanding of mewing is more along the line of Sandra Kahn's uplock method, which is creating that negative pressure and having your tongue passively suction onto the roof of the mouth. And chewing tough foods, which I basically say, don't overdo that. Don't be chewing ridiculous, stupid mastic gum 3 hours a day. That's only going to cause you problems. Just chew normal, healthy foods, meats and fresh breads and leafy greens, and just do this when you're eating as part of something you're already doing. Don't go out of your way to chew tough things. But even if in having a healthy swallow pattern, if you do all of these things, it's not going to change your bone structure as an adult, but it is going to train your muscles and it's going to help you keep your tongue up on the roof of your mouth when you're sleeping, which is going to help keep your airway open. And even if you expand your jaws to infinity and you have the best jaw in the world, if you don't know how to use your muscles and preserve this new structure that you have, it's going to relapse. So I assert that the role of mewing is not to actually expand the jaws, but it's rather to preserve any expansion that you do get, or to simply to preserve the structure that you have right now,
Mhm.
and also to get the most out of the structure that you have or that you're going to have. In other words, there's form and then there's function, and mewing is the functional part. And yes, there's an interconnected relationship there where if your form is too small, it's hard to have the good function, which is what I call the mewing catch-22, which is sometimes your jaws are too small to be able to mew in the first place, in which case you have to expand just in order to be able to mew.
Yeah.
So there's this dynamic relationship. But yeah, mewing is necessary but not sufficient.
And then what do you think other people's definition of mewing is? Because for you, you're kind of talking about like function and breathing and myofunctional therapy type thought process, but those who aren't, on board with or your followers and the general population, do you think mewing they think is like an aesthetic change to the face, or what do you think other people are trending this?
Yeah, I think that mewing, as it's hashtagged on TikTok, probably means pressing your tongue firmly onto the roof of your mouth so that you can look better and have a sharper jawline. So it's limited to tongue pressing, not even tongue suctioning, by the way, but
Right.
tongue pressing.
We talked about that last year. When you interviewed me, we were talking about like suctioning versus pressing. And I was like, we don't teach pressing your tongue up. We teach gentle suction. Um, okay,
Exactly.
so you think general population or TikTok people or whatever are like press the tongue up firmly to the roof, just press it strongly. And then are they clenching down or biting down to trigger contraction of the jaws or what?
So I don't know. And honestly, this question of whether the teeth should be in contact when mewing is an interesting one to me. And personally, I don't do that because it's not comfortable for me and it compresses my airway. So I have a habit, whether it's a good habit or a bad habit, it just is what it is. It's a compensation that I do where I still slide my mandible forward a little bit, to the point that my teeth are sort of my front teeth are over and under, tip to tip. Um, but yeah, I think that probably the mainstream definition of mewing also involves chewing tough things and sort of hypertrophying your facial muscles, whether it's through a toy like a jawliner or a Jazzercise or big boluses of gum. Um, but so when you have this idea of mewing as pressing and chewing to the extreme, it goes to the extreme, and you end up with what people call hard mewing, which
Okay.
is like actively pressing your tongue as hard as you can onto the roof of your mouth, like literally like
Yeah, I'm trying to do that right now to see what it feels like. Yeah.
yeah, it's a lot. And
Mhm.
um I mean Lord knows I tried it
I
for
bet
a
you did.
long time.
You
And
try everything.
for sure. I am the guinea pig of this space, for better or for worse. But yeah, for people like me and you that have weird neuralgia issues and neck issues, that just makes things spasm and stuff. And then for me, it always led me to clench in my sleep,
Hmm.
so, which is interconnected with why was I waking up with these headaches? For me, I don't think it was just the neck posture, although definitely was that, but I think it was also a bruxism thing.
Yeah.
So, um, yeah, mew, and then the ultra extreme of mewing is, thumb pulling, which is, hey, why use your tongue when you can just stick your fingers in there and just pull it with your hands?
That I
Um,
didn't know. So that's a thing, thumb pulling?
yes,
Okay, so
yes.
what do? You push your thumb on the roof of your mouth?
I think like I think the idea is you're literally using your thumbs like a face mask where you stick your thumbs in and you
Okay.
kind of
Now I've seen that with babies, infants, to help kind of, yeah, grow the jaws, get them moving forward. But so adults might be, do you call it thumb mewing or
thumb pulling.
thumb pulling? Okay. Thumb pulling. Okay.
And
Interesting.
then and then there's bone smashing. Have you seen that?
Oh, what is this? Bone smashing. Okay.
So for anyone who wants to know what this looks like, just go to Astro Sky's Instagram. He's a good friend of mine. He's a really early mewing influencer. Great guy. Great results, by the way. Looks great. But he just did a video on Instagram where he had a hammer and he was just going like this with it. He was going
Oh my gosh. Hammering. Okay.
hammering his zygomas and hammering his mandible to because it's like I don't know if you've ever seen like Kill Bill or Kung Fu training
Okay.
where they punch wooden boards and then your knuckles eventually get harder. It's the same idea. You apply a force to the outside of the bone and you don't get any
Isn't
inner
that like a
airway change,
bunion?
but
Like we're talking about like that's like bunion concept, right? You're growing bone as a protective mechanism, right? A
I
face
think so.
bunion.
Yeah, I think so.
So obviously that's aesthetic. So we're trying to get like that chiseled facial look. Is that kind of what the guys are
Correct.
doing? Okay.
Correct. But of course, because mewing in the public sphere is an aesthetic thing, it's not an airway thing.
Right, right, exactly. It's an
Yeah.
aesthetic thing. And yeah, that hard mewing and all that, it's aesthetics, which is definitely not myofunctional therapy because myofunctional therapy is increasing muscle tone to get the articulators, so the tongue, the lips, the jaws to rest in a comfortable, relaxed way. It should not be a hard pressure. It should be a comfortable relax. So kind of restoring what is normal, restoring what's
Yeah.
normal. Gentle suction of the tongue, relaxing the face, allowing with that suction, the lower jaw to drop and slightly relax. But when you're pressing your tongue as hard as you can, and that's not natural, that's not normal, but that's maybe triggering, some overuse of muscles in a different way. So that's interesting, and thank you for clarifying all those interesting topics. Bone
Yeah, sure.
snapping, thumb pulling. Now we're gonna have like adults sucking their thumbs because they're like, oh, I'm not supposed to suck my thumb. I'm pulling my thumb. Yeah, watch, I go, my kids start coming home, like sucking their thumbs, but they all do the mewing thing. It's like crazy.
Yeah.
Where was I? Oh, I went to Hawaii as a little family vacation a couple weeks ago, and people are coming down the water slide at the pool, going like whatever, the mewing on the water
The
slide.
emoji thing. Yeah.
Yeah, doing the mewing, and they were saying like, "Oh, mewing." I was like, "I just saw people on the water slide mewing." Like, it's just a funny, it's a really, but kind of cool that something could spread so much, so fast, and bring this awareness. Like, wow, can we shift that to like airway, breathing, sleep? Now that we have the audience, kids are listening. Could we now turn that into like healthy breathing, healthy eating, why that's important? Don't you feel like we
Yeah.
have that like grasp? How can we change that from maybe aesthetics or some aesthetic trend to getting into schools and teaching kids, okay, mewing, but let's talk about what we're doing and how we can do it correctly, and nasal hygiene and sleep hygiene and
Yeah.
up, and like how can that help with our breathing? You know, I mean, I feel like wow, some of the battle in a concept is getting people to listen. But when you have people listening, now how can we shift it to the health um thought and the airway thought? Because probably obviously, like you said too, it's aesthetic and a trend, and it's not an airway thing.
Yeah. I think it's going to be hard to get kids to get motivated to do something more for a health reason because speaking for myself, as a teenager, I was basically invincible to some degree and I could abuse my body any which way and
Yeah.
not really feel it the way I feel it now and the way I started feeling it in my mid 20s and early 30s. So that sort of glow of youth, I think, is a tough shield to penetrate when trying to get health lessons across to kids. And on the converse of that is aesthetics are hyper important to kids, especially in the social media culture. So I think that that's why they that's why it has gone viral, because it speaks to their aesthetic insecurities and their health airway insecurities. They probably aren't even aware that they might have airway issues because they're just numb to that sort of thing. But also the redeeming thing for me though is that if the mewing trend can at least get kids to be nasal breathers,
That's
that's a good thing, you
Well,
know?
what if we shift it to, hey, you want to be good looking and have like really nice structured face. Well, you probably want to grow, you want to be tall, have big muscles, like your whole body. Well, if your tongue's sucked up, your lips are closed, you're like blowing your nose and using X clear, you're gonna sleep better. And sleep is when 90% of growth hormone is released. If you sleep well, you're actually gonna grow and be that strong person you want to be. Like we can kind of go that route too, because we
Right.
can always shift that to aesthetics somehow. Yeah, they might not be concerned about like airway health, but if they understand airway health and sleep health means you're going to look better, less
Yeah.
wrinkles. You're going to feel your eyes won't have those bags on your eyes. Look how clear your face is going to look. Your skin, like when you're sleeping well, when you're breathing well, you're sleeping well, you're going to look better.
Yeah.
I know.
I I think that that's a great idea. I think the other thing about mewing is that it's immediate in their mind. Like you can literally go from this to in
Mhm.
2 seconds. Like you snap your fingers literally on these TikTok reels. It's like
Yeah, yeah.
it's an immediate transformation, which everything is quick fix now, right? So um you might even lose them just on the as soon as you take away
Yeah,
the immediate connection,
right.
you might lose them. But these are all great ideas,
Yeah.
and these
Hey,
ideas are probably good for adults too.
you blow your nose real fast. You can mew and blow your nose. Oh, add the nose blowing hygiene. I'm like trying to think of something like quick little tips in there. But yeah, it's a weird world how we can spread something so fast to so many people. But there's positives to it. So I think I was just talking to Roger Price the other day, and he was talking about like Generation Z is like the kids now who are all into TikTok and social media, and they're going to be changing like the health outcome of people because they're listening and they're spreading this information quickly on social media, and that's how we can kind of have some redemption of healthcare and everything is the generation right now. So they're listening. They're angry. They want it. They want change. They want quick change. They're listening. They're not just trusting like what a doctor says or what one person says, but they're looking things up online and communicating. And so I think people are going to, in general, be more aware of breathing, airway, and not just, aesthetics. But it's an interesting thing, the mewing. I never fully grasped what it was, and now I can see you have a little bit of a different concept, and I see it. So,
Yeah.
um, so
Yeah, I
how,
hope you're right. I hope you're right
at least I can
about
hope.
Gen Z.
Yeah,
Yeah.
that's what Roger Price said. It's an interesting thought. So how do you feel like you've contributed to the airway revolution?
What is the airway
Well, I don't
revolution?
know. I made that up.
Well,
I feel like now this kind of change of people attending to breathing and jaws, bone growth, having increased space for breathing, and realizing the importance of breathing and sleep and posture. So we'll kind of put those all together. I feel like we're kind of in an airway revolution right now
yeah,
where these things have become important to so many more people, and so many people are listening, and there's fields of study, and myofunctional therapy is almost like a trend, like people want to do this. So people are thinking about this now where maybe they weren't 20 years ago.
no
So
doubt. No
you
doubt.
have a role in that,
Yeah.
your platform. How do you feel like what kinds of things have you done or contributed in this realm?
I think that my role has been to be the bridge between the mewing world and your world.
Okay.
So I made it palatable for young kids to realize that there's more to this curiosity that they have, or this inkling that there's something wrong with their face, than just pressing their tongue up onto the roof of the mouth. So I speak to those people because I'm young and whatever, and I'm not a professional. I'm maybe a little bit more accessible to them because I'm just a regular dude. But then I show them people like, Dr. Gunson or Dr. Casey Lee or orthodontists and Marpy, and I prime them for this more professional understanding, this higher level, more scientific understanding of what they're actually thinking and experiencing.
So you are kind of like what we just talked about, but not in a school, like getting it to young kids in a school, but there is an age level and a young age level that you are making that connection of mewing and breathing and airway and posture and sleep.
Yeah.
So you are actually kind of doing that. Even though
Yeah.
you said it might be hard to get through, you've taken that connection of aesthetics and your connection with people and your experience, and you've spread that information. So that's
Yeah.
pretty big. Um,
And then if there's, if I died today, what I would be proud of was the fact that my content talked at least one person off the ledge of doing a dangerous tooth-borne expander, and helped at least one person avoid a dangerous MSE overexpansion or asymmetry. So I'm proud of the fact that I brought attention to some of the darker aspects of even the orthodontic and surgical expansion spaces, putting light on the risks that are associated with some of these treatment modalities that people often stumble into when they realize that you can have this artificial jaw augmentation if you work with a doctor or dentist.
yeah,
Yeah.
that's good information. And as like you do airway patient advocacy, is there like a certain some books or podcasts or things you might recommend to some of your clients?
Your podcast I frequently recommend.
Thank you. Thank you.
It's a good one. I mean, I think it's better than mine, to be honest with you. I don't know why I have the followers that I do, but that you don't yet. So I'm sure people will pick up. Maybe like I said, it's because I'm telling you, my audience is mostly young. It's mostly young men, to be honest, between
Yeah.
15 and 30, let's say. And but certainly if they were to discover your channel, they would all watch your podcast first.
Well, we'll
Because
put this on your channel also, so we'll get them. Just like,
you're
just joking.
sure. Okay. Um, if you want to. But um,
Any book, like, did you read the book
oh,
Breath?
books.
Yeah.
Breath. I like breath, but I also don't like breath. I think it's dangerous. it's a gateway into the tooth-borne trap.
Oh, yeah. Okay.
You know, he, again, just like so many of these so-called TMJ dentists, general dentists doing orthodontics, which, by the way, I have many friends in that who fit that description, and there's certainly some good ones out there that are doing responsible expansion for people. But the TMJ dentists, like James Nestor, they get the diagnosis right, but then they offer you the wrong treatment,
Yeah.
which leads people astray and causes lots of problems for a lot of people. I think he did was it a homeo block or a bio block?
It was homeo block.
Yeah, and that was sort of where he ended. Like, there's this massive problem out there of people having small jaws, and we need to breathe better, and so do the homeo block. And it's just like, how many people went and did a homeo block after reading that book? I know many personally who I've spoken to. So don't love that book, although I love the first 75% of it. I like Sandra Khan's book, of course. She has another book coming out soon. I think it's called Breathe 4.0, which is all about uplocking, which I think is
funny because
great.
you mentioned her and I'm interviewing her next Monday. So she's
nice.
on after you. So that's kind of funny, coincidental. Yeah. So we'll talk to her about that.
I really think that her term uplocking, I think that, because I've often used the term suction mewing, and I don't know if you have a catchphrase for what we call when we gently suction our tongue onto the roof of the mouth, but she calls it uplocking, and maybe that's going to be the one that sticks. But her emphasis on that, I think, is really important, because I think a lot of people miss the importance of suctioning. So yeah, she's great. She also has a lot of wisdom for kids, which I find useful. But other books, not really. The people I talk to generally aren't big readers.
Yeah.
Did you know Gen Z doesn't really read much?
They don't read, they just listen. Short, you need 2 seconds. You can do 2 seconds of information. That's
exactly.
funny. That's interesting. Well, I appreciate all your time here. I know you wrote in your ebook about like your hopes or thoughts, and you said part of your sort of outcome of what you want, your hope, is that you said, I pray that you will achieve a healthy airway and the most beautiful face possible, and without the unnecessary cost, pain, and suffering that I had to go through to pave the way. So, way to use your experience to spread a message and help a lot of people. So I really thank you for all that you've done, and for helping support the field.
Oh, right back at you, Nicole. And it was a pleasure to be on your podcast, and an honor.
Thank you. Thank you for all your time. I appreciate it so much.
You're very welcome.
Take care. Thank you so much for joining this episode of Airway Answers. I'm hoping some of your airway questions were answered. Please feel free to give us a rating or a comment. And if you have any further questions, you're welcome to email me at nicole@airwayanswers.info, or check out our site at www.airwayanswers.info. Thank you so much, and join us for the next one.